You're watching this video because you may have a hereditary cancer syndrome, which significantly increases your risk of certain types of cancers. Knowing this information helps you and your healthcare provider take steps to reduce the risk of cancer in you and your loved ones. This may be a lot to take in, but don't worry, I'll talk you through it. Most cancer happens by chance, a random distribution among any population. But some families experience more cancer than can be explained by chance alone. There are genes in your body that help fight cancer. And if these genes are broken, you and your family are at significant risk for certain types of cancer. These broken genes or mutations can be passed down through generations of a family, from your mother or father. Testing for these mutations is done through either an oral rinse sample or a simple blood draw. Myriad offers testing to determine if you have inherited one of these broken genes. If you have a mutation in either the breast cancer 1 or breast cancer 2 gene, also known as BRCA1 and BRCA2, then you have a condition known as hereditary breast and ovarian cancer syndrome, or HBOC for short. People with HBOC are at extremely high risk of getting breast and ovarian cancer in their lifetime. For example, the average woman has an 8% chance of getting breast cancer. That increases to a risk of between 15 and 40% in women with a family history of breast cancer. However, a woman with HBOC has up to an 87% chance of getting breast cancer, a much higher risk. Now let's talk about ovarian cancer. The average woman has less than 1% chance of getting ovarian cancer. That increases to a risk of between 4 and 11% in women with a history of ovarian cancer. However, women with HBOC have up to a 44% risk of getting ovarian cancer. Again, a much higher risk. Men on average have less than a 1% chance of getting breast cancer. Men with HBOC have up to an 8% risk of getting breast cancer. They also have up to a 20% risk of getting prostate cancer compared to a 14% risk in most men. By knowing if the cancer in your family is due to hereditary reasons, you can take steps with your healthcare provider to reduce your risk of cancer. There are several options to reduce your risk, including more frequent breast exams, mammograms, MRIs, medications, and maybe even surgeries. If you have HBOC syndrome, your healthcare provider will explain your options in detail. But it doesn't stop there. It's also important to share these test results with your family members. Your parents, children, and siblings will have a 50% chance of having the same broken gene and should get tested to determine their cancer risk. Other family members may also be at risk, and hereditary cancer testing is the only way to definitively know who has the broken gene. If you do not have a mutation in BRCA1 or BRCA2, you probably do not have HBOC syndrome. But because you have a family or personal history of cancer, your risk of cancer may still be higher than the average person. For questions about your cancer risk or other hereditary cancer syndromes, please talk to your healthcare provider. We understand that you may have concerns about insurance and privacy. Federal laws like HIPAA and GINA, and most state laws, prohibit discrimination regarding insurance eligibility, benefits, or premiums based solely on genetic information. Additionally, it is Myriad's policy that test results are disclosed only to ordering healthcare providers, unless you state otherwise. Testing for hereditary cancer risk is becoming more common, especially as new options become available to reduce your cancer risk. Although each case is unique, most insurance companies cover the cost of the test at 90% or greater. Myriad promises that we will work with you to come up with a financial option that's right for you. We are committed to making sure that test results are accurate, timely, and financially accessible to everyone. Thank you for watching this video. I hope that you found it helpful. If you are interested in more information, talk with your healthcare provider or visit our website at www.mysupport360.com.